Welcome back to Medigap Show. I'm Holly Cohen, and today we're going to explore the ins and outs of Medicare. No sales pitch here, just solid information. But before we dive into this educational journey, stay informed by hitting that like button and subscribing to our channel. Your support helps us bring important information to all Medicare beneficiaries. Let's begin about Medicare 2024, starting with Original Medicare. Original Medicare, known as Part A and Part B, is the backbone of our federal Medicare system. Part A covers inpatient hospital services, while Part B covers outpatient medical services. When you're on Original Medicare, your Medicare benefits are administered by the federal government, meaning you're on your red, white, and blue card, your red, white, and blue Medicare. But how does Medigap, also called Medicare Supplement, fit in with Original Medicare? Medigap plans, also called Medicare Supplement plans, complement your Original Medicare coverage. They fill in the 20% after Original Medicare pays the first 80%, leaving you with a very low out-of-pocket cost for the year. These plans are identified by letters. There's Plan F that you're eligible for if you were born prior to 1955, and Plan F leaves you with zero out of pocket. It covers everything 100%. There's Plan G. Plan G is almost an identical twin to a Plan F. Plan G also covers the 20% after Original Medicare pays the first 80%. But a Plan G leaves you with a small deductible for the year, which next year will equal $240 for the year. There's one more letter, Plan N, which also keeps you firmly planted on Original Medicare. It's a little lower in premium than Plan G, and Plan G is lower in premium than Plan F. On a Plan N, you may be subject to a $20 copay at your doctor's office and a potential $50 copay at an ER and possible Part B excess charges. Those three letters are called Medigap plans. They keep you on our federal Original Medicare, which is a no-network system allowing you to go to any doctor, any hospital in the whole United States that takes your red, white, and blue card. And this is the time of year, October 15th through December 7th, that you're allowed to come off of a Medicare Advantage plan and enroll in a Medigap plan. The rates will vary based on your state, and so will the health status requirements. Some states require you to go through medical underwriting. If you've had Medicare Part B for more than 6 months, you would have to go through medical underwriting to get a Medigap plan. And then you would go back to Original Medicare for January 1st of 2024, and your Medigap plan would also begin January 1st of 2024 once you're approved by the Medigap insurance company for a Plan F, a Plan G, or a Plan N. Now, let's shift our focus to Medicare Advantage and see what all the hype is about. Medicare Advantage, also called Part C, offers an alternative to Original Medicare. These plans replace your federal Original Medicare red, white, and blue card with an insurance company taking over and managing your care. There are specific differences. Number one, you're no longer on the federal Medicare program, which allows you to go anywhere you want without network restrictions or hardly any restrictions. Being on a Medicare Advantage plan, you are managed by an insurance company that many times is out to make a profit rather than take care of your health, because these are publicly traded insurance companies that offer Medicare Advantage plans. When you choose a Medicare Advantage plan, you're opting for a bundled package that combines your hospital, your medical coverage, and often does come with additional benefits, such as a prescription plan and some over-the-counter benefits, transportation, some other items might be added into a Medicare Advantage plan. But remember, it is replacing your Original Medicare. So here's where things can get complex being on Medicare Advantage. Many of these Medicare Advantage plans require prior authorizations, which means you need to have the insurance company approve the procedures before you're allowed to go through with the medical treatments. These are called prior authorizations. If you remain on original Medicare with a Medigap Plan F, G, or N, you're on original Medicare, and anything your doctor deems as medically necessary for you must be paid 80% by Medicare, and then the gap, the 20%, your Plan F, G, or N will pay the balance of the bill, depending on which one of those letters you choose. But a Medicare Advantage plan does take you off of that federal system, which means that you're now in the arms of privatized Medicare, meaning you have an insurance company managing your health care. They put you in a PPO or an HMO network, so you definitely need to make sure all your doctors take your Medicare Advantage plan. You also need to check how much your prescriptions will cost, because on a Medicare Advantage plan, the prescriptions, which is called Part D, is also bundled inside, and you don't have a choice to leave that Medicare Advantage plan if, for any reason, a different standalone Part D plan may cover your prescription better than the Medicare Advantage plan would. When you're on original Medicare with a Plan F, G, or N, you have a standalone Part D. When you have Medicare Advantage, usually that Part D is inside the Medicare Advantage plan. That doesn't mean always that the copays are going to be less expensive on Medicare Advantage than if you were on a standalone prescription plan. In fact, for 2024, there is a standalone Part D prescription plan that I have found covers so many medications very well for our clients. For 2024 is a $0 monthly premium Part D prescription plan. One of the complexities of Medicare Advantage is the potential for doctors to change plans and come out of your network partially through the year. This can be a huge source of concern for Medicare beneficiaries on Medicare Advantage plans, and something to really consider before you decide which way you're going to be on for 2024. If you need expert advice, we provide free Medicare consultations to help you make the most important decision for yourself for 2024. Not sales, just guidance. Give us a call at 855-265-6334. We are here to explain everything in detail until you thoroughly understand it. Whether you choose to go original Medicare with a Medigap plan or a Medicare Advantage plan for 2024, it's important to pick a plan that aligns with your specific needs and your specific Medicare scenario. Thank you for joining us today. Don't forget to like and subscribe, and even share this video with other Medicare beneficiaries to help them understand their choices for 2024 and Medicare's annual enrollment. I'm Holly Cohen, and at medigapcares.org, our priority is to provide you with educational resources. Until next time, stay informed and make the right choices. And as always, be well.